Hi, I'm Dr. Robert Friedman, Professor of Psychiatry and Pharmacology at the University of Colorado. My research colleagues and I have discovered that prenatal choline supplements, taken along with other prenatal vitamins, may help prevent attention deficit disorder and autism in childhood. I'd like to share that information with you today. If you want more information on how we discovered choline's effects and other things that it might do, I recommend our second video, Schizophrenia, Prenatal Prevention Possibilities. Welcome to Preventing Mental Disorders Before Birth, or Myth and Miracle. To begin to talk about preventing mental disorders, we need to dispel a myth or two. Myth number one is that children are born perfect angels, free of any mental problems. Reality number one is that 1 in 10 children are born already carrying risk for a mental disorder that will show itself early in childhood and affects their entire life. This is a little boy, a kindergartner, with symptoms of attention deficit disorder of the hyperactive type that are appearing early in his childhood. We see him pushing over a boy in front of him, and he will be disturbing the little boy in blue. This is a choral presentation of kindergartners, and let's see what's going on. Children are singing away. He's not malicious, but he's kind of exuberant, and he pushes over the little boy in front of him. We'll look at it again. There's the push. The song continues, comes to an end, wave to the parents, pay attention to the teacher. Quit talking so much and behave yourself. You're disturbing all of us, says the little boy in blue, not fazing the little boy in black, who simply turns to the girl on the other side and annoys her instead. This kind of behavior inevitably results in a parent-teacher conference, referral to pediatricians and school resource people, and a diagnosis of attention deficit disorder of the hyperactive type, ADHD, is common. That's a good thing, because otherwise boys like this grow up to believing they're troublemakers and don't do well in school. With treatment, he's likely to be able to concentrate, quit disturbing the class, and learn what he needs to learn. Let's look at another example of attention deficit disorder, this time of the inattentive type. And we're looking at the little girl with the white headband who's turned to the girl next to her because she is unable to follow the directions of the teacher. Again, another kindergarten class. The song's about to begin. The fingers go up. Our little girl kind of gets it up. But as the movement becomes more complicated, she's lost and turns to the girl next to her to see what's going on. Still can't follow it. You may notice that the teacher is not going to pay much attention to her. We don't pay attention to people who don't pay attention back. Gets the finger up, but doesn't get the tap on the top of the head. And so she's missed over what half the teacher is trying to get her to do. Little girls like this are generally ignored. They don't cause trouble, and it may be several years before people realize that she's not learning at the rate that she should be. And in some cases, it's never picked up, and girls like this just grow up to believing they're stupid. Now let's fast forward for 25 years. These are producers at BuzzFeed who made a video about their ADHD, their experiences in childhood and then later in adulthood. And you can see the first woman has already said, I misbehaved a lot as a child.
I misbehaved a lot as a kid, but I didn't mean to.
The natural environment of a classroom is very non-conducive to somebody with ADHD. You know, just like this quiet room, you're sitting at this table, a bunch of other kids are all doing their work. It was almost like it's sensory overload, like everything is coming at you all at once.
I would be trying to focus on this teacher, and then all of a sudden I would like snap to it again, and I had missed half of what the teacher had talked about. It was like you're high or something. Like it was like, it's kind of similar to being high.
One of the side effects of ADHD is a sort of an inability, or at least a tough time staying still, concentrating, focusing on day-to-day tasks.
I feel like my thoughts are sort of on like a carousel in my brain, and it's going in circles, and each thought stops for like 2 seconds in front of my eyes. I can barely grasp it, and then it's gone.
The third day I was at BuzzFeed, I was taking some like safety test with my friend, fellow producer here, Caitlin, and I'm like already lost on like the packet. I look over and like Caitlin's answered like the first 10 questions already. And it's just that's like the story of my life is like looking over to my friend and being like, how the hell did you just do that?
It's the story of her life. ADHD is more than a childhood problem. Its effects last a lifetime. She's still turning to the girl next to her to figure out what she should be doing, despite the fact that these three young people are obviously bright, have good jobs, and yet ADHD has never left them. Let's look at one more symptom of childhood dysfunction, and that's social withdrawal. And we're going to be looking at the little boy underneath the white arrow, and you'll see immediately how he has an inability to be with the rest of his class. He's climbed away about as far as you can get. The teacher's aide makes him come a little closer, but not that close. And now for him, the hardest part, the singing. Because he's hypersensitive to noise, he's looking away, wringing his hands. He's taken another step away from the class. He's swaying to his own movement. And watch his left arm. He's starting to swing it vigorously, not in time with the music, marching to the beat of his own drummer. This behavior, withdrawal from contact with other children, and hypersensitivity to sounds can be early signs of autism disorder, like Asperger's syndrome. And the movement of his left hand is a behavior called stimming. He's attempting to substitute his movement to drown out the sound that he can't stand. Now let's fast forward again, about 8 years this time, and we're going to be looking at Sam, a middle school student who helped his team win the high school STEM competition. Sam has Asperger's syndrome, a form of autism, but he was able to work with his team well enough to develop a 3D printer and the computer interface to control it. But let's hear how he feels in school.
They know I'm different. They just don't know what makes me different.
Sam's mom, Sherry.
That's really hard to see your child be rejected or just struggle when you're driving in the car and he says, I just wish I was normal. And he is, and he has so many great things going for him, but the other kids just don't get it.
It's okay. Don't cry.
Don't cry on television, Mom. ADHD and autism are both lifelong illnesses. The tech moguls recently have all subscribed to being autistic. First Mark Zuckerberg, then Elon Musk, and now Bill Gates. But Gates, like Sam's mother, noted that his greatest regret is that he couldn't preserve his relationship with his wife Melinda, which he treasured above all other things in his life. So, reality number 1 in 10 children are born with risk for a mental disorder. Myth number 2, the mother's womb is the perfect protected place for the baby to grow. Reality number 2 is that's true. There's no better place to grow a baby than the mother's womb. But the baby's development is impacted by many challenges to the mother's health and by the genes that the baby has received from both its parents. Life in the womb is unpredictable. Mother's health challenges can include infection, stress and depression, substance use, and then genetic risk that the baby gets from both the mother and the father. Each of these increases the risk for mental disorder in the baby. Up to 10% of children with a severely ill parent will develop the same illness themselves. But generally, it's a combined genetic risk from healthy parents. So, how do we manage risk to the baby during pregnancy? These are the common questions that arise. Are vaccines safe? Well, what happens during infection is that the mother releases cytokines early in the infection to try to ward off the virus or the bacteria as soon as she senses it's there. That's that awful feeling that you get about 4 o'clock in the afternoon when you know you're coming down with something and you better get home and get to bed as quickly as you can. That is the release of chemicals that are attacking everything possible foreign in the body. Unfortunately, that includes the placenta. Particularly male placentas are being attacked by their mothers. And as a result, any step in brain development that's supposed to happen at that time is compromised. And the risk for mental illness in the child is doubled. How about an occasional drink to lower stress? After all, stress is not so good. And if a drink now and then can be helpful, why not? The school is out on that one because an occasional drink, less than 3 to 5 a week, and no more than 3 at any one sitting, is the minimum threshold at which we see changes in the baby's intelligence and brain structure. Below that level, there aren't detectable changes in most babies, but perhaps in some. And there are genetic changes in the mother that may make her less likely to be able to metabolize alcohol quickly and get it out of her body. So can you have an occasional drink? Probably. Will it affect your baby? Probably not. But we're dealing with probabilities, not certainties. Another common question is, how about marijuana for morning sickness? Generally, that's something that's considered only by mothers who've been using marijuana before they got pregnant. They have a trusted relationship with a dealer, and they believe that the dealer has their best interest at heart over and above any pharmaceutical company that might supply a drug that the doctor recommends. Marijuana dealers regularly receive health warnings not to give marijuana to pregnant people because it increases the risk of problems for the baby. These have been well known since marijuana was made legal in the Netherlands, and the same thing is true in the US. But the majority of dealers say that they have a special marijuana strain for morning sickness. There's nothing special about the strain, and there's no evidence that it helps morning sickness, but it's become very popular, particularly among younger pregnant women. You share infection, alcohol, and marijuana with your baby. If you feel it, that awful choline feeling, that awful cytokine feeling, the feeling from an occasional drink, or even the feeling from marijuana, your baby can feel it too. The placenta and the baby are no better protected than your brain is. But it's your decision what's best for you and best for the baby. What about genetic risk? How do I know if my child will have genetic risk for a mental disorder? There's no gene for attention deficit disorder or any other mental disorder that can be tested. Everyone has the same basic genes, just like all of us have the same basic face. And yet all of our faces look different, and all our personalities are different. And all these are controlled by genes. Small, normal variations in our genes give us different appearing faces and different personalities. 9 in 10 people with mental disorders do not have a parent with that disorder. The genetic risk for mental disorder is more often a combination of the otherwise normal variants from both parents. So let's take a look at that. Here's Dad. Intense, successful, occasionally moody, but easily controls it with a bottle of beer with his buddies. Mom, creative, sometimes uninhibited. We show her here as a flower child. He's a successful real estate developer. She runs a terrific dress boutique. And so they decide to have a child. Let's simplify their genes. So we'll make him have an intense moody gene. But genes occur in pairs. He got one from his mother, one from his father. And from one of them, he got the intense moody gene. And from the other one, healthy vanilla. Mom, similarly, a healthy vanilla variety and a creative uninhibited variety, a gene pair. Now he goes to make the sperm. Sperm can only carry one of these pair because the mother will be contributing the other of the pair so that the baby has now a new pair. 50-50 chance whether he puts intense moody or healthy vanilla into any given sperm. And here we see 4 or 5 sperm crawling around on the egg, each hoping to be the one that gets in to fertilize it. 50-50 chance one of them might have intense moody, another healthy vanilla. Mom's egg similarly has only one, healthy vanilla or creative uninhibited, and there's no way to know which one is in that egg. And so the daughter's born, and by chance, 50-50, she gets healthy vanilla from the dad and healthy vanilla from the mom, and she's a happy child with many friends. The son gets intense moody from the dad and creative uninhibited from the mother. It's a very interesting combination because he becomes a very creative artist very early in his childhood. He has all that intense emotion, which he can channel through his creativity, and uninhibited, he creates new art forms that just explode off the page. People are wondering how bright his future might be. But he also has told his mother that occasionally he hears voices. And he also has been smoking cigarettes. His father has smelled them in the car. And so this family that didn't think they had genetic risk for mental illness has already been down to see a psychiatrist. And the psychiatrist has told them there's about a 20% chance that their child will go on to develop a more serious mental illness. But most of these children will either grow out of the voices or continue to hear voices that don't trouble them too much during most of their lives, and they may use substances like cigarettes or even marijuana to help control these voices. But in some artistic communities, he's going to be very well accepted. Reality number 2 is that mothers have many health challenges, and they amplify the other challenges that come from the baby's genetic risk. So enough. A couple of philosophical points. First, you may think that fate never played a role in your life. Well, it was a 50-50 chance at conception, fate, what you got from your mother and what you got from your father. Hopefully your brother and sister turned out so well. Second, Women make all their eggs before they're born, while they're still in their own mother's womb. And so women plan way ahead for conception, even before their own birth. Men do not start to make sperm until they reach puberty, and then they make 100 million viable sperm every day. So women plan way in advance and get things all set, whereas men are always planning for conception. Of myth, let's turn to some miracles. Miracle number one is that prenatal folic acid prevents major defects in fetal brain and spinal cord formation. Anytime we talk about prenatal miracles, we begin with folic acid. The miracle is a miracle in several ways. First of all, the prevention of major defects is lifetime. Once the spinal cord and the brain have closed normally, they stay closed the rest of the life of that individual if folic acid is supplemented in the first trimester. Folic acid is a natural food, but in order to ensure that the spinal cord is closed and that the brain is closed normally, a supplement is needed. The supplements were discovered to have this effect, and for 10 years no one believed it. And so no further testing was allowed, and the finding just sat in scientific journals. For 10 years, then, mothers continued to have babies with a birth defect that might have been preventable had they taken folic acid. Finally, after 10 years, the critics relented and said, okay, give it another try, and it was immediately successful. Now, all women are recommended to take prenatal folic acid. It's part of prenatal vitamins that are available without prescription. And to ensure that babies whose mothers didn't take folic acid in a timely way get some exposure to it, folic acid is supplemented in all enriched flour. So most slices of bread, cake, and cookies that you eat have folic acid supplements. Not that you need them, but they're there to help the baby whose mother has not yet started prenatal vitamins. Finally, after birth, you can give all the folic acid you want, but it will not close a spinal cord or a brain that hasn't been adequately developed before birth. Miracle number two is very similar. In 2016, we reported that prenatal choline enhances fetal brain development. Second and third trimester supplements during pregnancy can prevent mental problems later in childhood, like the problems we've just been looking at. The American Medical Association, the American College of Obstetricians and Gynecologists, and the American Academy of Pediatrics now recommend prenatal choline along with folic acid for all pregnant women. So here's one of our clinical trials, one of 5 trials that was conducted worldwide by different investigators. 100 women, 12 to 14 weeks pregnant, with no apparent illnesses. We started with normal women because the risks during pregnancy are unpredictable. So these women's pregnancies have started off normal, but what will happen we don't know. And we don't know their genetic risk for mental illness, other than none of them were mentally ill themselves. They were blindly randomized to choline or placebo. Neither we nor the mother knew what supplement she would be getting. They appeared identical. So 50 women received choline, 50 women received placebo, plus prenatal vitamins and choline dietary guidance. Why would we tell mothers on the placebo arm to eat as much choline as possible in their diets? Because we didn't want any baby deprived of choline. Towards the end of the trial, my head nurse, Julie, who'd been visiting the mothers 3 or 4 times during their pregnancy to look at their pantries, to check their refrigerators, and to encourage them to eat more choline-rich foods, came in to see me. She was upset. Julie, what's wrong? I said. Oh, Dr. Friedman, I've been worried about it all day, and I didn't know how to tell you, but I've wrecked your study. You wrecked the study, Julie? Yes. I made sure that all the women had as much choline as possible. Julie, of course, didn't know who got choline and who got placebo, so she was encouraging all the women. Julie, I said, if 100 babies are born healthy, we're both going to be happy. So don't worry about it. You did your job. But as we continued to follow the babies, here's what we saw. At 3.5 years of age, we asked the parents to rate problems in attention and social withdrawal, the kinds of problems we've just been looking at. They were rating whether their child could play with a toy for a long period of time, whether the child was easily distractible, whether the child could shift attention, focusing first on the toy and then putting it away when it was time to put it away and cleaning up to come to dinner. We also looked at social withdrawal. Could the child play with other children? Could the child relate to teachers? Did it have a good relationship with the siblings? And did it bond and cuddle with his or her parents? Boys don't generally do as well as girls early in development at 3.5 years of age, but there was a marked improvement if the mother had taken choline during pregnancy compared to those children whose mothers got placebo. A little less marked in the females, but nonetheless a significant effect overall. Similarly with social withdrawal, problems nearly disappeared if the mothers had taken choline rather than placebo during pregnancy. Choline is a natural substance, some made in your body, most comes from your food. During pregnancy, it's a building block for the brain and the body of the baby, and it activates key stages in the baby's brain development. Over 2/3 of women are deficient in pregnancy because the baby's demands for choline are so high. It's the only time in the life cycle you can be deficient in choline. The rest of the time, you get plenty from your diet and what you make on your own. Only during pregnancy are women deficient. After birth, human breast milk has more choline content than any other known breast milk, and infant formula is fortified with choline. So the baby gets plenty of choline as soon as it's born, but it doesn't get it in time to form its brain before birth. Does choline make super babies? Choline supplements do not make genius babies. What choline does is help prevent fewer babies with low to below normal intelligence. 10% of placebo children have problematic attention and social withdrawal, the kinds of problems that are predicted to give them problems in school and later in life, versus 1% of those in the choline group. Choline also has some other benefits. It helps babies to be born full term after a full gestation with less jaundice and more normal birth weight, particularly for girls who are more likely to be under birth weight. But a good diet has all the choline you need is something we hear frequently. So let's go through a good diet. How about breakfast, an egg and a burrito, 150 milligrams of choline. Lunch, a tuna salad sandwich is a good choice. Do pick the low in mercury variety, 70 milligrams of choline. A healthy snack is a quarter cup of peanuts, 25 milligrams. And for dinner, a salmon fillet. Actually, farm raised is going to be better because it's less likely to have mercury, 100 milligrams. Total, 345 milligrams. That's a good diet. The average for U.S. pregnant women, in fact, is 340 to 380 milligrams. But the FDA recommendation for pregnant women, which is somewhat dated, is 550 milligrams. And the new clinical trials, like ours, indicate that about 1,000 milligrams is optimal, in addition to a good diet. So a supplement is needed. There are many available. No prescriptions needed. This one is widely available, nature made, in many drugstores, grocery stores, Costco. Choline bitartrate, 800 milligrams. It comes in 3 267 milligram capsules. You should have one a day, and it would cost about $150 per pregnancy. We don't recommend this over any other brand. I'm just showing you one. Our website has many others listed, all of which do a good job. But you're strictly vegan. Choline in supplements actually comes from soybeans or sunflower seeds, and capsules can be made vegan. If you take a supplement and you're vegan, you don't have to rely on eating soybeans. You'd need about 5 cups. Then you can have all the wide variety of plant-based foods that make a vegan diet so healthy. Breast milk from vegan mothers usually contains an adequate amount of choline, but there's no harm in taking the supplement during breastfeeding, just to make sure. When can women start choline? Good news, choline's safe to start at any time, including preconception. If it's an IVF pregnancy, we suggest you wait for your doctor's okay to make sure that the embryo has implanted and the pregnancy is proceeding normally. There's still then time to begin your choline in the second trimester, when brain development is at its peak. That's also the time when mother's choline naturally falls to its lowest level, because the bump is beginning and the baby's growth is accelerating. That's the time when choline is really needed for a key stage or two in brain development. More choline in the third trimester helps, and it helps develop the baby to normal birth weight, but it will not reduce second trimester problems. Should all women or only mentally women take choline? Any baby can be at risk, and choline may help. Bettering the baby's odds is what choline can do. Infections, COVID, flu, when they attack the placenta, choline can protect the placenta and also support the baby's brain development. Again, vaccines are the primary prevention. If stress and anxiety hit, mothers will tend to hold choline in their own livers instead of giving it to the baby. That's part of their stress response. Antidepressants can prevent stress, anxiety, and depression. That's the primary treatment, but choline can help, because when the mother's depressed, she's also attacking the baby with her cortisol, her stress hormone. Marijuana, nicotine, and alcohol do penetrate into the baby, but it turns out, at least for marijuana and nicotine, that they are attacking the development of the same cells that choline can support. So we recommend abstinence for women, but choline can help support the baby if the mother ends up using marijuana and nicotine to a limited amount. Heavy users are going to have problems no matter how much choline they take. And finally, genetic risks for mental disorder. One of the genetic risks for mental disorder that's common to ADHD, autism, as well as schizophrenia and some types of bipolar disorder is a problem in a receptor that choline normally activates. So giving high choline can overcome some of those genetic problems. So we've listed choline for all these problems. Do we believe that it's a cure-all? No. Choline is a positive step that you can take. Unfortunately, there aren't many other than choline and folic acid that can be taken during pregnancy to try to prevent the baby from having problems from the many challenges that the mother's health and its own genetics provide. It's also one of the few steps that you can take during the baby's entire lifetime that will have lifetime effects. So it's a simple step that any mother can take, but certainly it doesn't cure all problems. An important question to ask is, are there side effects? How safe is choline? The doses we've recommended are well below the 3,500 milligrams of choline, which is the FDA's upper safe limit. At 7,000 milligrams, men in laboratory studies began to have some cases of low blood pressure, and so the FDA set the upper limit at half that, or 3,500 milligrams. If you Google choline on the internet, you may see warnings about TMAO, which is a byproduct made by some intestinal bacteria if choline reaches the large intestine. About 10% of people have this particular strain of bacteria. High levels of TMAO are associated with problems in men who have heart disease. But we have not seen high levels of TMAO in women who take choline as we recommend it, and during pregnancy, women are relatively protected against heart disease by their high estrogen. So we haven't seen this kind of problem in pregnant women. To put it in further perspective, eating shrimp, lobster, or sea fish raises TMAO levels much higher than choline does. But TMAO does not affect the placenta, and it does not cross the placenta to affect the baby. What if you miss a choline capsule or start later in pregnancy? Please don't blame yourself or stress out about it. Most women in our studies took only 70% of their supplement capsules. Some of them started as late as mid-pregnancy, and some of them got the flu or COVID even after they'd been immunized. And many were using marijuana or drinking when they conceived, although for the most part they stopped sometime well before the end of the first trimester. None of these things seem to cause increased risk to the fetus. So please don't think that you have to be perfect with your choline. You may begin to wonder how you turned out so well. Your mother was depressed, she smoked, and she drank while she was pregnant, and she never heard of prenatal vitamins or choline. Well, first, you were lucky. You received a good combination of your mother's and father's genes. And secondly, your mother probably ate beef liver and spinach. Beef liver has 420 milligrams of choline, the highest of any food, and spinach gives a good shot of 167 micrograms of folate. So thank your mother and father for their good genes, and also your mom for what she ate during your pregnancy. Now, if you're not planning to get pregnant yourself, and you tell your children or grandchildren who may be planning pregnancy about what you heard in this video, you may be rewarded someday with the following telephone message. We're not planning anything yet. Don't get excited. Nothing's going on. But what did that doctor say about choline? You can be pretty sure that they already suspect that there's a pregnancy, and hopefully you'll soon be rewarded with a healthy, happy baby for a lifetime. There's more information available on my website, robertfriedmanmd.com, or on prenataldoctoradvice.com. A few disclosures. This presentation is for educational purposes only. Only your doctor can provide medical information for your situation. I have no commercial or any other ties with nutrient or pharmaceutical companies, and all the research was done at the University of Colorado, funded by the NIH and the Institute for Children's Mental Health, and regulated by the FDA. And finally, this is the work of many collaborators, all of whom I thank very much for their participation.